Hello. Today I'm going to fill the lips with my style. For this, first I should give her a numbness treatment. For that region I am going to give anesthesia to her lips. I use ultracaine. It is very effective product with artecaine and epinephrine in it. So I get the drug in my syringe and now I'm going to inject upper part of the lips, a little amount, to give her a very comfort treatment. After injecting the anesthetic, a little I wait. I wait because I want the drug get effective. And then I'm going to do that. You know, there is an anatomy we should know about. The arterial supply is very important. And around the mouth there are some arteries, and especially in the mouth, in the lips. And when you inject the lips, you can notice some bleeding. To stop the bleeding, I use my technique. A little bit later I'm going to show and I'm going to share it with you. I never inject the material into the muscle because for a long time I am doing this treatments on the lips, and I noticed some of my patients what I did, what I injected the material in the muscle. Sometime later I noticed some muscular atrophy on the lips. So the atrophy, it is not possible to cure it. And for that reason, I always inject the material submucosal level, not in the muscle, but below the mucosa. Here, I very much like to inject ultra, high-level ultra with a 30 gauge needle. And the needle is 13 millimeter length. Now I'm going to ask my patient if she has any numbness or not. Uyuşma var mı? Evet. Var. Evet. She told me she has some effect, and I'm going to start. Here you see my needle, 13 gauge, 13 millimeter length and 30 gauge. And all the time the bevel down. My patient to open the mouth, and from the cupid bow and the upper part I insert my needle very, very superficially. You see my needle, and I check it under my finger. When I reach the red line, I stop and check my needle and start to give the product during retrograde. When I reach the top, I stopped and changed the angle of my needle, and again went to red line, reached the red line, and again checked my needle, all the time bevel down, and retrograde I inject the material. And here again I change the angle, reach the red line, checked my needle, and start to give the product with retrograde. Yes. You see, a little bit lifted. And again, at the same point, I do insert the needle, but not the red line. I stopped on the middle line of the lips, and I give the material. Here you see again, and again. And I go on. I'm all the time on the submucosal level. You see, I reach the red line and stop there, and I inject retrograde. I go on. Now, on left side, all the time I stopped the red level of the lips and then across there, and I inject material with retrograde. You see my needle below the mucosal part of the lips. Can you notice what changed on the lips? Many things changed, and you can see the filling result. And I'm not going to inject much more to upper lips, but in the lower lips, from down, again, I stay submucosal level and I insert my needle, bevel down, and I inject with retrograde. Change the angle, moving into the lips, but not muscular level. You see my needle below the mucosa. And after the injection, I wait 20 days, and 20 days later, again, I want to check my patients. I will check after checking her lips. Maybe I could give some more material. I finished the treatment, and let's look the lips. You will see what changed on her lips, and I'm sure she will be very glad to have new formed lips. And she didn't have any bleeding. This is the more secure way of treatment. You see, no any bleeding. It's safe and very effective, and it is very easy. Even you can do it with ultra. But do not forget to use 30 gauge needle and bevel all the time down. Okay? So, if you have any questions, do not hesitate to ask me. Bye.